Is a nurse practitioner salary worth all of the debt, stress, and the extra years in school that you need to get it? The DNP degree is a good degree if you want to actually be a provider instead of just doing bedside nursing, obviously. You can prescribe in some states, you can actually see patients and make judgment calls and not actually be under the supervision of a physician in some states. So that's kind of exciting. I would view that as the more relevant thing rather than the finances of the actual degree. So if you are going to go into becoming a nurse practitioner, that is the more relevant thing to think about. Why is this? So think about the starting salary of a nurse practitioner. You're thinking really around $90,000 in a lot of places. It's a bit of a range, $80,000 to $100,000, and that is a salary that you can actually get with a BSN in some parts of the country. For example, if you are in California or a lot of the West Coast where there's an actual shortage of nurses with just a Bachelor of Science in Nursing, then you can actually easily make $100,000 in a lot of places. So given that, becoming a doctor, nurse practitioner, being a DNP, given that degree can pay, $90,000, $100,000, those incomes can actually be quite similar. Now, if you're going to be in a place like Mississippi, Alabama, somewhere where nurses don't make as much, then yes, you're going to get a premium on your earnings for being a nurse practitioner. But I just thought I would mention that because the financial aspects are also that you have to, in many cases, give up a year's worth of salary to attain that role in becoming a nurse practitioner. Sometimes, of course, you can go to school part-time, but a lot of people, they just stop working and they go back to school, and that costs them opportunity cost of several years' worth of salary. So I would not look at becoming a nurse practitioner in the lens of, is this a better financial decision? I would make it more in light of, what do you want to do with your career? Our average nurse practitioner is actually owed about $150,000 of student loans. That ranges, of course. We've seen people with, $80,000 and really low-cost programs up to $200,000 or even $250,000 for very high-cost programs because they can last 3 or 4 years. And when you borrow the maximum, obviously those hundreds of thousands of dollar cases are possible. If you owe a whole lot relative to your income, then you might consider pursuing a forgiveness strategy under something like pay-as-you-earn, where you pay for 20 years based on your income and then get the balance forgiven and pay a tax bump. If you work at a 501c3 hospital, though, you might be able to pay for 10 years instead of 20 and have the loans forgiven tax-free at the end. We generally suggest pay-as-you-earn for nurse practitioners because you can also file taxes as married filing separately to exclude your spouse's income from your payment calculation if loan forgiveness is the better option. If, though, you have a debt-to-income ratio below 0.75, then you work in a private or public hospital, it might make sense just to pay it all off. For people who do work in a not-for-profit hospital, I would say that, if you even have a debt-to-income ratio that's 1-to-1 even, I would probably pursue loan forgiveness under the PSLF program. In a private hospital, basically a for-profit hospital system, then I would consider just refinancing at a debt-to-income ratio of about 1.5-to-1. We've helped a lot of nurse practitioners, just like you, trying to figure out what to do with their student loan debt. At varying levels, right, and a huge different range of debts and incomes. So we'd love to help you come up with a custom plan. Just reach out to us, help@studentloanplanner.com.